I had a patient come in today about 2 or 3 months out of a FaceTite procedure. That's one of the radiofrequency based skin tightening procedures I offer, and I have a lot of videos on YouTube about. And unfortunately, she wasn't very happy with the result that she saw so far. She was pleased with it. There's a lot of good to it, but there were still some concerns. And she brought these to my attention because when she went down the Google rabbit hole, she found herself on a review website called RealSelf. And this website gave her an opportunity to share her experience, or at least learn from the experience of other people who have considered or gone through with this technology. And I was shocked to learn that my beloved FaceTite procedure is not as highly regarded to the public as I once thought. I want to explain why. Hi everybody, I'm Dr. Jonathan Zelkin. I'm a board-certified plastic surgeon in Newport Beach, California. I specialize in plastic surgery of the face, breast, and body with a recent emphasis on facial slimming and sculpting. This is a very, very important aspect of my practice, and in particular, a combination therapy between buccal fat pad removal and radiofrequency skin tightening and liposuction that really helps people change for the better. I'm very happy with the technology, and I think the satisfaction rate, let alone the success rate of this procedure in my hands, is very high. And so I stand behind it very fervently. And I'm surprised when I sometimes learn that not all patients have the same experience. And so today I had a rare opportunity to look into this technology further by perusing the website RealSelf, which has not only reviews of doctors, but also procedures. And I was sort of shocked and a little bit disappointed to find that the FaceTite procedure indeed wasn't as highly regarded as I have experienced it in my practice. In fact, I've gotten to a point where I don't like doing facial liposuction without FaceTite on my side. It's a very important tool in my armamentarium. But you can't ignore the facts, and these facts are that community-driven reviews don't always point to the same direction. And I want to talk about why. When you're going to a pizza restaurant, do you review the restaurant or do you review the ingredients used in the restaurant? When you review a painter, are you reviewing the paint that he or she uses, or are you reviewing the service that is received? When I saw that FaceTite had a lot of reviews and I see sort of a consistency in the unhappy patients, it quickly occurred to me that there is a huge problem here. A procedure is being reviewed without any regard to the surgeon that's using it or any regard to patient selection and candidacy for that procedure. I think rating FaceTite procedure is really unfair to a lot of surgeons who are performing the procedure very carefully, judiciously, and controlling who they provide the procedure for. And I think it doesn't account for the variability, the spectrum of expertise of providers who are offering this technique. I can see that the price of this technology ranges from anywhere between $2,000 and $10,000 or $20,000, depending on who's doing it. In some states, nurses are offering it in their clinics. In other states, it's only board-certified plastic surgeons that are doing it. So you get the whole gamut of providers. One thing I want to make sure that the entire community understands is that FaceTite is nothing more than a tool. It is a resource. It is something that helps a plastic surgeon achieve an optimal result. It alone cannot achieve a scarless facelift, for example. It alone cannot ensure that a patient has adequate soft tissue contracture or even will be happy with the procedure. FaceTite in my practice is a noun. It is a technology that I use, and I even call it radiofrequency assisted lipolysis with targeted liposuction. It is not a verb. I didn't FaceTite somebody. Somebody doesn't choose me for FaceTite. Somebody chooses FaceTite because I offer it. And that is an incredibly important distinction. I think there's a lot of merit in these befores and afters that I see. And one of the common themes that I'm seeing is that A, some patients are sustaining burn injuries, and B, other patients are simply seeing a deflation of their skin envelope. I have often been questioned as to why liposuction needs to be performed with FaceTite. It's because FaceTite is a tool that provides heat energy and basically injures the deeper structures, the fatty layer of your face. That in turn causes inflammation, which causes collagenesis and ultimately some degree of soft tissue envelope contraction. It also cauterizes blood vessels in so doing, reducing the amount of bruising that I've seen in my patients and also minimizing the course of inflammation. However, it's not for everybody. And if you've come to my practice, I think chances are you've even been told that you are not a candidate for FaceTite, because I am seeking procedures that optimize the patient experience and outcomes. And if you are a candidate for FaceTite and I can get that result without a big scar, downtime, or general anesthesia, believe me, I will gladly offer it to you. But it is not for everybody, and I want everybody to make that very clear. It is not a replacement for the facelift, and it is a way potentially to fend off a facelift. But everybody who would benefit from some degree of fat sculpting in their face will benefit from FaceTite. Anybody with loose skin alone, it's less likely. That's the biggest distinguishing factor. I hope this video helps. I encourage commentary. I hope you guys subscribe. I'm a huge fan of FaceTite. My obvious disclosures are that I'm a key opinion leader for the company and that I do believe in the technology, and I also gain financially when people choose to undergo this procedure. So I do have important disclosures, and I will say that the technology is not without failure. I'm not saying it's 100% satisfaction rate, but it's very high. What you need to do is make sure that you are choosing a surgeon who provides FaceTite. You are not choosing FaceTite as a standalone procedure. Thank you so much for taking the time to watch this video. Take care.